So you're saying most likely, especially if it's moderate to severe CVG, your surgical approach would be the best for
Right.
patients.
They've tried injecting cortisones. Other than that, there's not a lot of options.
Cutis Verticis Gyrata. What is this rare scalp condition and how do we treat it? Today, I had the immense pleasure to sit with one of the leading experts in this condition and its management, Dr. Jerry Cooley. He's a legend in the field of hair restoration and is an absolute gentleman. I really hope you enjoy our talk. I always have sort of a image in my mind of a guy with sort of wrinkles on his scalp. And usually I feel that it's like a very, if I just think of a patient that I've seen with vertices cutis gyrata on the street, it's usually a bigger guy, shaved head that has these furrows and wrinkles on their scalp. So it is rare, but I'm certain almost everyone has seen it and come across it at some point.
Yeah, I talk to people a lot because I tell my other patients about I have this little niche treating this condition, and I ask them if they've ever seen it. And I would say it's, of the people I talk to, maybe 50-50, but it just may be in your location. It's more common. I don't know if it varies around the world.
So let's start off, I guess, with, what is this condition, CVG or Cutis Verticis Gyrata?
Right. So as the name suggests, cutis is skin, verticis is top of the scalp, gyrata means looks like brain. So it's a very apt name. It's skin on the scalp that looks like brain tissue. It's actually the worst case that I've ever come across. On the left, this is how he first came to me with his hair medium length. And then when we shaved his hair off, this is what we found. So this is an extreme example of Cutis Verticis Gyrata. And if you look at from the side, you can see how it does resemble gyrations of brain tissue.
Certainly.
And this is after a couple of scalp reductions and hair transplants. So that's pretty much the worst case I've ever come across, but I do think it's a good example for showing what CVG is.
So you say it's pretty rare. It's not all that common. How common would you say it is? Is it more prevalent in males versus females? Is it more prevalent in certain races like African versus Caucasian?
I haven't seen actual published statistics, but I can tell you in my practice, I've only had one female over the years, and I would say it's about 75% African American for me, then maybe disproportionate Hispanic, and then Caucasian would be the smaller minority.
Okay. And speaking of how common it is in the population, you're not sure exactly, how many
I've
people
heard
per,
estimates of 1 in 100,000, but I don't know where they came up with that, how accurate or reliable that is.
Who gets this condition? Is it something you're born with, or is it something that can sort of develop later on in life?
They have basically divided CVG into three categories. There's something called secondary CVG, and if you have a tumor or something that produces a hormone that makes your skin proliferate, one example would be acromegaly. If you're producing too much growth hormone, then that could make the skin proliferate. I've never seen a case like that. I never see secondary CVG of any kind. Okay. And then there's primary, and there's two different types of primary. One type of primary, the patient has an associated health condition. They may have seizures, mental retardation, they may have other medical problems, and this shows up as part of the syndrome. But then the other type of primary essential is there's absolutely no associated health condition, and those are the cases that I've seen. I've never seen anything but primary essential, meaning these patients are completely healthy with no underlying health problems. Now, as to why they get it, in all the reading that I've done, I've never seen any mention of what the pathogenesis of this is. However, virtually all of these patients, it comes up in puberty when their testosterone is rising. it proliferates for a few years, it stabilizes, and then it stays the same. Interestingly, I've had a few other patients who never had it in puberty, but in their 30s or 40s, they went to get testosterone replacement and the CVG appeared. So I am virtually certain that this is due to either testosterone or dihydrotestosterone. And we know that DHT can make those genetically predisposed to balding. It makes their hair shrink and fall out. It can, testosterone and DHT can be involved in acne. It can be involved in hirsutism in women. So this to me is just one more thing that androgens can cause. That's my theory. I have not seen that published anywhere.
That's so interesting, and that kind of coincides, I guess, with that typical CVG sort of figure I have in my mind of like one of those gym bro lifter, thick neck kind of guy with these massive gyrations, all over the scalp. So obviously, as you said, exogenous testosterone use could potentially cause the condition. And what about exogenous growth hormone use as well? I know a lot of the guys that are big into gym and stuff that like to use growth hormone, testosterone derivatives.
I have not seen that. It might be possible, but I have not seen that. One other thing that I have seen that can potentially exacerbate CVG, patients have told me this, is that oral or topical minoxidil, which is kind of interesting. Years ago, people would often ask me if Rogaine could cause wrinkling, and I always dismissed it, but it kept showing up over the years, people asking about it, saying, I never had these forehead wrinkles until I started using minoxidil. Well, I've had several CVG patients tell me, because they've also had concomitant hair loss, that when they started minoxidil, their CVG got worse. So there does seem to be something there, that the minoxidil causes hyperproliferation of the dermis in those who are predisposed.
I think it has to do something with something interfering in collagen production, potentially. Causing
not interfering, but maybe stimulating collagen production.
Okay, because I've also seen some concerns about minoxidils causing wrinkles, and I always thought that was interfering with collagen production, and that's why the wrinkles were formed. But I've never seen it in my practice, minoxidil causing wrinkles. But
no, I've never seen it either.
So if somebody has this condition, let's say it's not the secondary type, which would be caused by another disease, be it cancer or genetic disorder or endocrine disorder, but it's that first type of primary, the one that is not associated with any neurological disorders either. How would somebody get this treated? What would be your approach to treating these patients?
Well, short of surgery, I know what's been tried is, probably the most common thing that's been tried is injecting hyaluronidase. I've seen a couple of reports of very extremely mild CVG, which appears to improve with hyaluronidase. But a lot of the patients come to see me who have more moderate to severe CVG have already tried hyaluronidase. They've spent significant amount of money on these treatments, and they've seen absolutely no improvement. So I think if it's extremely mild, possibly it could have a role, but I'm not very impressed with the results that I've seen.
So you're saying most likely, especially if it's moderate to severe CVG, your surgical approach would be the best for patients.
They've tried injecting cortisones. Other than that, there's not a lot of options. People have talked about doing some very minor surgical procedures rather than a full-blown scalp reduction, which is what I do, in an attempt. But again, I haven't seen, I've heard people talk about it, but I haven't seen any really good results posted on it.
And I've also heard that could use sort of fillers, either hyaluronic acid or
fillers, right?
fat transfers.
Right. My issue with that is the analogy I use with people is it's like you have a suitcase that's stuffed too full of clothes, and adding more into it to me doesn't make sense. You may get some improvement in the furrows, but you're just loading it up more, and I think you're going to create an unnatural look. You need to take out, really, it's too much skin in too small of an area, and you just need to take out the skin and pull it together.
As you said, it's too much skin in too small of an area. So when you're doing your scalp reductions, okay, do you use expanders at all, or do you just sort of cut and put it back together? What is your
So I
approach
don't
generally?
use any expanders. That generally requires a 12-week waiting time to pump up the expander, and most patients don't want to go through that period of deformity. And then the other issue is that for an expander to work, you want to expand the unaffected area. So you would need customized expanders that were sort of like donuts, where you don't want to really stretch the wrinkled scalp. You want to stretch the normal scalp.
Okay.
And I'm not even sure they make expanders like that. But in any event, people who come to see me, they want a one-time procedure if possible, maybe possibly come back for a revision. Most of them are going back to work in a week. They don't want to advertise to everyone that they've had this done. They're extremely self-conscious and embarrassed. And if you're walking around for 3 months with a giant expander, that's just not going to work.
And so what is the recovery like for these patients after this procedure?
So everyone plans on at least taking 1 week off. There certainly can be pain and swelling during that first week. Typically, we'll leave the stitches in for 2 to 3 weeks, but they can get that done locally. And if they let their hair grow a little bit, they can hide that. I have them avoid any heavy exercise for 1 to 2 weeks. Otherwise, the recovery really isn't as bad as you might imagine.
Okay, that's cool. And how many of these procedures would you say that you do, per month or per year?
Well, we're doing more and more. I've done over 40 of them at this point, but I'm doing them basically every week now, just because, I mean, it's kind of a funny story how I got into it. I didn't by any means deliberately choose this as something I wanted to be an expert in. About 15 years ago, well, actually, let me take a step back. I got into the field in the 90s, and scalp reduction was a popular procedure at the time. So I learned how to do scalp reductions. And then shortly thereafter, everyone realized it wasn't a very good treatment for male pattern hair loss, and it was abandoned. But I had that training and knew how to do it. And then about 15 years ago, a patient came to see me with balding. He had some moderate CVG, and I said, this will really look better if we can smooth out your scalp first and get rid of the CVG, which we did. And I put the results online, and then kind of word got out. Dr. Cooley knows how to take care of CVG. And, it was maybe a year later, one more came, and the next year, 2 came. And then probably about 5 years ago, one of my patients came to see me. He had heard that I did it, and he posted his experience on Reddit, which is a social media platform popular here in the US. And then it was just like the numbers took off. There was a CVG support group, and these guys started talking about their experiences. And then they're like, okay, I'm going to go to Dr. Cooley. And then they would document their whole experience. I had nothing to do with it. I didn't promote it. They just did it on their own. So now most of my patients find me on Reddit.
Okay, wow.
That's how it all came about. That's how I came to be a CVG expert.
And would you say you enjoy doing these procedures? I mean, I know hair
Oh, yeah.
transplants are so rewarding, and I'm sure the same for these procedures because, obviously patients are distressed, and it's certainly something that can affect your entire life.
Absolutely. I find that these guys are and when I say guys, I've only done one female, but these patients are extremely grateful, and more so than the average hair transplant. Occasionally, you have the transplant patient that tells you you've changed their life for the better, but virtually all of my CVG patients tell me what a dramatic impact it's had on their life. So I genuinely love doing these, and I'm trying to build it up because I do enjoy it so much. If it was, I actually make more money doing hair transplants than I do CVG, but I just love doing the CVG repair. So that's kind of where I'm hoping to get to a point where, I'm doing at least one or two every week. Trying to get the word out, teaching people. A lot of times, unless people have been on Reddit or somewhere, they just feel like they're the only person in the world with this condition. And so it's very isolating, and they may or may not know even what it is. And so that's just, it's one thing if you have balding, everyone around you, or
Right.
a lot of people around you are going bald, so you know what it is. It doesn't necessarily make it better, but you know what you have. But when you have this weird condition and you don't know what it is, that makes it, I think, a lot worse.
And do you do it like in your practice, or do you have to go to like a fully sterile operating theater somewhere?
So I do it right in my own OR in my office. I think part of the benefit of training in the 90s, I was a dermatology resident, and I went to my first hair conference in LA in the 90s, and they had this video library of different hair techniques. And I was watching these doctors do scalp reductions in their office. And, some of them would have their shirt and tie on while they were doing it. I was like, you can do this in your office? And then I got some training with different people, and particularly dermatologists tend to do things like that in the office. And as long as you take certain precautions and you're safe about it, it does not have to be done in a hospital operating room. That would just double the cost for these patients. In general, the patients who come to see me with the CVG, just in general, don't tend to have the same financial resources as my average patient wanting a hair transplant. So that, I think, would price them out of the market if they had to pay for an anesthesiologist and the
Sure.
full hospital setup.
I guess we know the scalp is so vascular and heals so beautifully. And, scalp infections are pretty rare in general. Anything else that maybe you'd like to add on this topic?
Well, I guess the main advice I would give to someone who thinks they have CVG is to get online, find a support group. I think the Reddit support group is one of the best, and you can talk to other patients around the world who have the same condition and talk to them, find out what they did about it, how they deal with it. I think getting into a community like that is the best thing you can do for yourself.
I hope you guys really enjoyed this conversation. Let me know in the comments below what you guys think. And if you like this sort of content, we have so much more coming up with world-renowned experts on different subject matters. So please like and subscribe. Thank you very much.